Welcome, everyone, and thank you for being here. I'm Dr. Jennifer Salerno, founder of Possibilities for Change. Today, we're going to explore how technology and clinical science are transforming the way we identify and support youth who may be struggling. At Possibilities for Change, we're working to bridge the gap using evidence-based screening and trauma-responsive technology to help professionals identify risk earlier and support youth sooner. Just a little bit of background, Possibilities for Change was founded with one goal to equip professionals to identify risk early and support youth before problems escalate. We bring together three pieces that rarely exist in one system: evidence-based screening tools, trauma-responsive technology, and comprehensive support programs. Those are really our three pillars. And together, these help organizations move from reactive care to proactive prevention. A few quick housekeeping notes before we begin. Please feel free to ask questions using the Q&A box throughout the presentation. I'll come back to that and answer them at the end. And for the best experience, I recommend viewing the presentation in full screen mode. We have some images of the technology and some other pieces that you're going to want to be able to see clearly. So thinking about the landscape of youth risk, it's been changing rapidly over the last 5 years. Now, nearly 40% of high school students report persistent sadness or hopelessness, and that keeps incrementally rising. New research is linking digital media stress, social pressures, some of these other pieces to that increased mental health risk. And we've all seen that digital piece kind of come in and really impact our youth in a negative way. Today's youth risks go far beyond that traditional clinical diagnosis to include mood and mental health, substance use, that digital stress that I mentioned, which also kind of disrupts sleep, and their social environments have really changed. And that's why proactive screening is really becoming an essential piece of all types of care, education, and social environments that youth might be interacting with. So behind every screening, we think about screening and the workflow of that, but behind that is real young people with youth wondering, does anyone notice what I'm going through? Is it safe to talk about this? Will somebody actually help me? And our goal is simple: to ensure that the answer to those questions that they're thinking about is yes. Many organizations are already screening youth. I'm sure you're working in organizations that are either screening or talking about it, or talking about the implementation and what to do next. But the challenge isn't really that screening piece or the awareness of it, it's the action behind it. And common barriers to routine screening and then that intervention piece include just limited staff time. We're all very limited in what we can do and the quality that we can provide. Fragmented technology, you might be using different systems and figuring out how they interact with each other and can integrate. You may have unclear intervention pathways and difficulty using data and tracking outcomes, because we know screening alone isn't enough. We need systems that turn data into real support and action. Professionals consistently tell us that they need help meeting their needs. Streamlining screening, reducing administrative workload, improving youth engagement, generating meaningful reports and data that they can use, and involving parents. Parents are becoming more and more important to engage so that they can bring in that protective factor for youth, parents and other supportive adults. So Adam was really built to address those multiple needs when you're thinking about youth screening. Adam is a first-in-nation screening platform that was developed by clinicians and software engineers, as well as trauma experts, to really incorporate trauma-responsive principles into our Adam technology. Many youth struggle to talk about sensitive issues in that traditional interview style or disclose using paper screenings. We know digital screening environments, when they're designed carefully, allow youth to disclose risk more honestly and comfortably. The result then for us is better data and earlier identification of risk. And the screening experience itself matters. So if we dig into ADAM a little bit deeper, ADAM uses design elements that help youth feel safe and supported as they're going through and answering screening questions. Some of the elements in ADAM, you can see here the categories. Some of those that might make it unique is showing one question at a time, using very clear and simple language, having supportive visuals and audio features, a flexible skip options, and then empathetic prompts throughout their screening experience. And these features really reduce their anxiety, improve their engagement, and therefore increase honest responses. So the technology helps youth feel safe enough to answer honestly, but what we ask matters just as much. That's where our screening tools come in. At Possibilities for Change, we've developed comprehensive youth risk screening tools that can be used as traditional paper format or within our ADAM technology. And those tools you may be familiar with, the RAAPS tools, and then we have a new suite of tools called Tell, Talk, and Vent. These tools, both RAAPS and the Tell, Talk, Vent, are scientifically validated, age appropriate, and efficient. Because of our limited time, we want screenings that take only 5 to 7 minutes for youth to complete, yet provide a powerful picture of their well-being. That allows us as professionals to identify risk early and intervene quickly. Giving a little bit of information around those sets of comprehensive tools, RAAPS focuses on the leading risk factors contributing most to your youth morbidity and mortality. RAAPS includes screening across 6 key risk categories. You can see those here. It includes age-appropriate versions and also incorporates social determinants of health screening in our public health version. And this version of RAAPS was developed in partnership with the American Public Health Association. And then additionally, within the standard and public health versions of the RAAPS, there are scored subscales that screen for depression and for violence. And those pieces are a little bit newer, especially the violence component. Then I want to share with you our Tell, Talk, and Vent screens, or TTV. They take a slightly different approach. Instead of that broader screening categories that RAAPS have, it dives deeper into those interconnected areas like mental health, substance use, and sexual health. TTV also measures protective factors such as peer support and trusted adults. These tools begin a little bit earlier at age 8 and are designed to support early conversations and interventions or what to do next. In addition to the comprehensive screening tools, if we're talking about technology, ADAM integrates a wide range of targeted evidence-based screenings. These tools are screening for mental health, substance use, ACEs, and social needs. And that flexibility really allows professionals to start with a comprehensive screening and then drill deeper into specific risk areas when needed, or just use targeted tools for specific clients that they're working with. And the screening workflow is very simple. It combines the tools and technology into 3 steps. 1, the youth completing the screening using a device of choice. Step 2, a trusted professional reviews the results and has that conversation or risk reduction counseling when needed. And then step 3 is really that documentation, referrals, and follow-up support. So let's walk through the youth journey. A youth receives a screening link and completes the question on a device, either specifically at your location or through a cell phone, iPad, that sort of thing. If a risk is identified, the ADAM system flags it immediately. Youth receive supportive messages and resources through brief interventions. Those are delivered to all youth right away. And a trusted adult or professional reviews the results to have that risk reduction, coaching, or conversation afterwards, depending on the setting and the workflow. So, what begins as a simple screening becomes that pathway to support and ultimately that improvement in risk. So, if we dig in and take a look within the ADAM system, the youth interface was designed with that trauma lens and also direct input from youth. So some of the key elements you see here, they see one question per screen, relatable visuals, audio support, and very simple navigation. So these features help reduce that cognitive load, create a more comfortable environment for honest responses. And the other unique feature is that delivery of what we call brief interventions directly through the technology. So all youth that complete a screening receive brief interventions that are tailored to their results. These messages use motivational interviewing principles, such as providing a reflection of how they responded to a specific screening tool or what their risks were, an affirmation, a choice of options or menu of options, and then resources, which are links to trusted either national or government resources or local community resources. So by the time a youth meets with a professional, they've already begun reflecting on their risks and possible next steps, which can really help that next conversation. Then on the professional side, the system generates clear and actionable reports. So professionals can quickly see key risk areas, screening scores and interpretations, and recommendations for next step. This allows conversations to start at a deeper level rather than spending that time asking the questions, collecting that baseline information, maybe scoring a screening tool. All of that's done for you so that you can start the conversation further along. The platform also includes built-in action guidance, and this includes next steps. So a lot of times as you're screening, you may be thinking, okay, what do I do with this result? What are the next steps? So what we've included are protocols, tools, safety planning templates, and intervention resources that are clickable and fillable as PDFs. And those can be customized to resources that are specific to a particular agency or school. That allows professionals to access instantly the different documentation or information that they might need as they're reviewing results, helping them respond more confidently and efficiently when they're meeting with youth. But technology alone isn't enough. Professionals frequently ask, like, what do I say next when I find out about risk? Professionals need communication skills to respond effectively. Like, what do I say? How do I say it? And that's why we developed Mighty Change, a motivational interviewing online skill building program. So it really helps to equip anyone that might be talking with youth, whether they are a provider, whether they're an educator, whatever role they have, maybe working with youth in after school programs, providing them with practical evidence-based strategies to connect with youth and then guide meaningful conversations, guide them towards accessing services, getting help, all of those things that can be challenging and make us feel anxious. And how do we do that? The Mighty Change helps give you practical strategies to be able to easily navigate some of those conversations. And then parents are another critical piece of the solution. And oftentimes we wonder, like, how do we engage parents? We know that they're an important part of being a protective factor for youth. And when I say parents, I mean supportive adults or maybe others in a youth's life that might not be their actual parent. But through our Teen Speak program offered within the ADAM technology, parents gain simple, practical communication strategies to talk with their teens about mental health, substance use, stress, even some of those challenges at home that really affect relationships, like getting chores done, getting homework done, that sort of thing. So what TeenSpeak does is takes kind of those motivational interviewing principles and strategies and kind of puts them into a framework for parents to use. because even one trusted adult can dramatically improve youth outcomes. And TeenSpeak helps to strengthen those relationships. So there's never been a more important moment to really think about transforming youth risk, mental health, and wellness. We're seeing these four forces really come together. A rising youth mental health needs, like I shared in the beginning, strong policy momentum around mental health. CMS guidelines just got released, I think, a couple weeks ago for state Medicaid and CHIP toolkit for children's behavioral health services and the EDSDT, along with state support for school-wide screening that we've seen across states like Colorado, like Illinois. And then having that technology at the ready to support that momentum and that growing community demand, just in what we're seeing with youth, not just in healthcare, education, but at home, across communities, that we really want to make an impact. Because together, we can create this powerful opportunity to move from reactive systems to that proactive support networks for youth. So let's move from awareness to action. Every screening is an opportunity to literally change a life. Together, we can identify risks earlier, start conversations sooner, and ensure that every young person has those supportive adults that are equipped to notice, to listen, and to help. So this brief opportunity for training was really to provide you with some information on what's new with what we're doing around youth risk, creating screening tools, creating a technology to support not just youth, but also the professionals that are working with them, and really come alongside us in transforming how we support youth. If you're interested in learning more and talking specifically about some of the needs that you may have, please reach out by email. You can see my email here to schedule a meeting. Also in the chat, we are going to put a direct link to schedule a meeting on my calendar. We can discuss any of the solutions that I shared with you here or any other needs that you might have that you feel like we might be able to help in supporting that improvement in youth risk and well-being.